So we did cranial, we did visceral, we did organ lift, we did that every technique we ever teach. We're going to taught a whole seminar on him, and he's just a gracious guy. To clarify things before we quit, I'd really like to check a couple of people and show you through the protocol here so you understand exactly what's going on. Hey, Dr. Brett, would you come up and assist me? And I need one of the newer test kits. Do we have one up there? The thing that seems to be confusing people a little bit is exactly how the halogen protocol works. And the heavy metal protocol. No matter what the problem is I check on somebody, that is going to be my major thrust. So let's say he comes in, tell him real quick the kind of problem you have. You have a recurring hip pain, it goes into category 2 with a sacroiliac slip, and last night we just had a couple seconds to check it real quick, so we're going to finish that up today. But here's what I would do to get down to anything, just let everything relax. I want to have some kind of a reference. And of course, we've done a real patient, right? We've done a case history and orthopedic exam, neurological, all that. Now I'm just coming into treatment time. I would just see what kind of range of motion we have. And he's stuck right there. We're going to see what kind of motion we have here. And this side is a lot better. Well, when one side's just a whole lot better than the other, if there hasn't been trauma involved, I want to know, I wonder if there's an organ involved. So what's the greatest organ, the biggest, most mass in the whole body is the liver. The greatest by size is the kidney, is the skin, but the liver is the greatest by weight. So we go right here, he's just going to touch the liver. I'm going to check that same range of motion here, and look what happens. See how much better that was? I mean, you almost have to feel it to believe that can happen that much different. So we have a 90% improvement just touching his liver. We know that liver is a major problem. We don't know what's caused it yet. This is the kind of things that I found on Larry there in that hotel room. We started winding one step at a time what's going on. So at that point, I'm then going to ask the body what nutrition I need to help detoxify him. Okay, so what I'm going to do is I'm going to self-test, and I'm going to find out exactly which one of the metals he did. I could muscle test him like this. Is it this one, or this one, or this one, or this one? It's not, and this is the one that it is. So this mercury is what shows up that he has mercury. Now I self-test, like I showed you earlier, and it turns out to be mercury either way. I'm going to ask the body, you literally can do this, how many mercury drops can you tolerate at a time? Can you tolerate one at a time? Can you tolerate two at a time? When we get the change in muscle strength, when you ask him the question, that's the right answer. So he wants 2 drops of mercury under the tongue. This is homeopathic mercury. It's a homochlorate. It's in multiple strengths. No matter when he got it or how long he's had it, by going through 2s and 12s and 6s and C's and all that, all in one thing, then it helps to trigger it out. That's what they call it, homochlorate. So one thing I should show you is this will no longer make you weak. When I go back and check the range of motion, many times before I do anything else, it's better. So I check the range of motion here, and look how much better that is. So the same thing as touching the liver is now stronger by giving him the mercury drops, because evidently there was mercury affecting the liver. The next thing that we asked is what part of the brain was the mercury in? And had I checked the brain before, it told me nothing. The brain gets so locked up with toxins when you type of therapy localized in other parts of the body and we show. But once I've given the drops, so many about the drops, you go here and here, down he goes. So we know it's the right cerebellum. And we know that the cerebellum, even though it's only 10% of the mass of the brain, 50% of all neurological activity takes place there in the daytime. And we work on that with the adjuster, the percussor, nutrition, everything else. So we just check again. It's okay here, but it's not okay here. And I had done it before, it wouldn't show us anything. So I shine the laser on that area. And the laser is adding photonic energy to his brain to upregulate it. And we hold it till he goes strong. So it's completely strong now. Then I go to the opposite side of the cerebellum weakness to the cerebrum. We're going to check the parietal lobe, which is okay. We're going to check the temporal lobe, which is not okay. So we stay there, energizing that until it goes strong. Took that long, still a little spongy, still a little spongy. There, now locked. So I go to the opposite parietal and temporal. And I can check the frontal lobe of the brain. That has to do with reasoning and other mental functions. That's still a little spongy. He's sucking up a lot of energy now. There we go. Now I'm going to check occipital lobe, which is the visual cortex. He's fine. I'm going to drop down to the brain stem, which is weak. The brain stem is what keeps us alive, isn't it? It regulates heart rate, it regulates blood pressure, it regulates respiration. So if the brain stem goes up, that's what keeps us alive. That can cause problems everywhere. And now that's stronger. And the last place I'm going to check here is right over what we call the emotional heart, where the thymus is. And we checked it last week, and it was strengthened up real good now, so be strong. Once I clear out the first metal, and I have them strong everywhere, then I go ahead and do the whole scan. We call it the total body scan, or max scan now, right? And that's in your manual. Also, you can get these charts. We have them available through the office. It shows you the different points that we test. I recommend everybody has this in the rooms you test in, so the patients can see it, you can relate to it as you learn it. To start the scan out, we start with the liver, because it is the largest organ in the body. It has over 500 functions. You've got to start somewhere, so we start there. Right here, if you just all feel your own rib cage, you'll feel an indentation there. On the right is the liver, on the left is where the spleen is. So of course, just under the liver is the gallbladder and the cystic duct, and underneath the spleen here is the pancreas. So you've learned half the points already. So let's just check that. Here we go. Liver is weak. Wow, well, we can't find that before, and we got the mercury out of it, but that isn't enough. We've got to also support the liver, and so we're going to go max liver. When I come here then, max liver is as strong as it can be. With it. Without it, we go back into weakness. Just because we got the mercury out for a few seconds doesn't mean it's all gone. We're going to send him home with those homeopathic drops. We're going to have him take 2 drops once a day, at least for 30 days, and we'll reevaluate. We're also going to send him home with max liver. We're going to have him take 1-3 times a day. It's called max liver detox. And the sheet we just check off, and all that information is easy to send home with him. Dad, write this down so we didn't get up here with the sheets. So the liver was strong, was weak right to start with. So we check gallbladder, hold that real hard each time. Gallbladder, cystic duct. I'm going to go straight to his heart now, and his heart is weak. Somebody his age should not have a weak heart. Maybe we just jumped the gun. Maybe he wasn't ready. Maybe he aren't tired. Maybe a lot of things. But we'll see it again. Go here. I'm just going straight over the heart area. We call this emotional heart. Go to his weak. If I'm going to exactly go over the heart, I can go over here. It's the same story. Wow. That's not what you expect to see in somebody as young as he is. So let's find out what's going on. So we give him max heart, which is nutrition, feed the heart, or real tight, and it doesn't help it. You thought, wow, what is it then if it's not max heart? I don't know. Let's find out. With that in mind, I'm going to go straight to infection. Usually max heart, 90% of the time you can fix it. We're going to go down to the infection areas. Yeast is the belly button. Yeast, fungus, and mold. Not weakening there. When I go 1 inch below there, that's the viral point. It goes weak there. I go to parasite point, which is either equal area. Staph is here, and strep is here. It should be viral. So we have max viral. Let's see if that clears up the reflux point. It does. Then I'm going to go up to the heart, and that strengthens the heart. So what that 5-minute, 5-second, $5 test tells me, because I don't want to pretend I just ran an EKG or anything like that. But muscle testing, when I showed his heart, it is not strong enough. When I touch his muscle here, he's strong enough to withstand it. Or even in the fossa here, or even the hand here. But when I go here, he goes weak. So something's wrong. You should be able to go over an organ, not go weak. It's just my little bit of energy, which is only 1 Gauss magnetic energy coming out of the hand, makes his heart weak. And when I put a heart nutrient, it didn't make it stronger, but when I put an antiviral nutrition that knocks viruses out, helps the body do it, he goes as strong as a rock. Good thing we found that, because it can literally destroy a heart. We're going to send him home 1-3 times a day for 90 days. It takes you the nutrition to build the immune system up enough not to have that virus going there. That can have a lot to do with the way he's been feeling. Now, interestingly enough, I'm going to have work Dr. Brett over having hand me back that viral nutrition, because what else did we find that was weak right to begin with? The liver, right? So let me go back and check the liver. Oh, that even helps the liver. I said, well, didn't you fix that? No. We showed you that the homeopathic drops helped it, but when we challenged him, it still got weak, and it took max liver detox to make it strong. But also, the viral nutrition makes it strong. He can hand me back the max liver, I can have them hold one, and I can see which one is the most important. In that case, actually, max liver is even more important for the liver than max viral. The max viral is the only thing that affected the heart, so we have to send him home with both of them. So the next thing we're going to do is check blood vitality or homocysteine point. It could mean a methylation problem, or it could mean anemia, that type of thing. So you can do the whole front side of your hand on that same area, and he has nothing there. I go back side of the hand. This is the negative side. This is the positive side. It doesn't matter which side is weak. Either one is weak. That's blood vitality. If both are weak, usually you're really in trouble. A lot more problem. I'm going to check him for methyl protect and see how it does with that. It doesn't work for him. Why not? Well, maybe it's too much. So let's apply 5-MTHF and see if he can handle that. Because methyl protect had all kinds of stuff, including 5-MTHF, and MTHF is the answer. Now, also, I'm going to keep it here and have me SAMe. So you're down almost the third bottom there. Because SAMe is the intermediary step. We go here and see what happens. Whoa, that's really strong. I compare that to 5-MTHF, and I put them together, strong as a rock. So he has a methylation defect in there, has been my experience for that. You can run hundreds, even thousands of dollars of tests to determine that, but when I have found it takes two, like 5-MTHF, and they can't take methyl protect, and they also need SAMe, that's a real severe methylation problem. As I mentioned yesterday, next to taking in oxygen and burning it and getting off carbon dioxide, the most important thing the body does all day long to keep you alive and healthy is methylation. He has a methylation defect, probably more than one. This could change his whole world. Also, let me show you here, if I come back to the liver now, that will help the liver. Will that help the heart? That will help the heart. Now wait a minute, you said it had a virus in it, now you're saying methylation helps it. Well, if you don't detoxify, you're going to have all kinds of crap everywhere. But if you can detoxify by proper methylation, then he's not going to have a tendency to get virus infections and liver toxicity. Does that make sense to everybody? So we're going to do all three. We're going to detoxify his liver right now, help the nutrition to his body to take over, and I don't say the nutrition kills the virus, his body takes care of it. Right now he has too much overload, he can't do it. At the same time, we're going to beef up his methylation. This is going to change his world forever. Because if he has a methylation defect, it doesn't go away with the nutrition. Yet the nutrition allows you to live with your defect. So it changes the epigenetic expression of the gene. You can't change the gene.
Can you show the methylation again? How you test it
For what?
Methylation.
I did blood quality. And he got weak there. And methyl protect didn't work, which is 5-MTHF and B12 and B6 and all kinds of good stuff. It really shouldn't even, you can't use it. So the only thing that made him strong was 5-MTHF, which is the activated form, right, of folic acid. And then we also needed SAMe, which is the intermediary step to completion. And those both made him strong. So that's how we found that. From there, we come down to spleen. We come down to painkillers. He loses that battle too. He's in chiropractic school, so not to make anybody have problems, but he's getting a little carried away here. So we're going to give you Allomax. Allomax is a controlled release alpha-lipoic acid, which resensitizes to his insulin, but also clears, helps pass the blood-brain barrier, gets rid of toxins, etc. Now, just to show them Medcap IS, which is like the old Vanachrome that all of us used to use when I was with the other company, should be good for blood sugar too, but we can find out which is the best for him. I already know because I looked and saw, but I'll show you. He said, what do you mean you looked and saw? I just know that my next question is going to be with vanadil sulfate, chromium picolinate, the other B complexes in there, really help that, and I looked at it and said, no, it makes it weaker, and sure enough it does. So, back to what we were talking about a minute ago, you might as well learn to have a certainty you can figure this stuff out, and you can just look at it and tell you very quickly. Then small intestine is here, in Brimhall, ascending, transverse, descending, bladder, prostate, testicular is okay, kidney adrenal is okay, thyroid is iffy, and pituitary is iffy. Wow. So is it a thyroid primary problem, or is it pituitary, or hypothalamus telling pituitary to tell us thyroid? So we're going to chat. first thing I'm gonna check is hypothalamus pituitary, see what that does. That makes that stronger, that makes that stronger, and together, he's strong as a rock. All right, well, that's looking like it's a winner, but I guess what we can do, what about max male? That would be good, but it doesn't, it's not the queen. It actually makes him weaker. Even though, for me, it may be perfect, for you, it may be perfect, but he's the one thing on hypothalamus pituitary. Now, I have to go back with what made him strong. Didn't have to always, I just have to put it next to him again so the body remembers, oh yeah, this is what made me strong. To compare the thyroid. I compare thyroid now, that's not the winner for him either. You understand what I mean? When you give him one thing that makes him weak, he's thinking about the last thing you gave him. So if I compared him to that already made him weak, and then I put thyroid in there, I'm checking two things that make him weak, I would just know which one was the least weak. So if you find one that makes him strong, you have to go back to the strong one, the body remembering strong, before you compare the next one. Fair enough?
You say that again?
Okay, let me show you. I mean, the other one. Yeah, no.
What was that?
I found in his particular case that hypothalamus pituitary, max hypothalamus pituitary, made him strong. And it took care of these weak reflexes. But when I compared it to thyroid, which normally would be pretty dang good for somebody like this that showed a weak thyroid, the body says, no, the other one was better. If I now go in to check max male for comparison, I'm comparing male to thyroid. Well, those are two things that made him weak.
Right.
I don't really want to know that. I want to know which one's the strongest. So I would better go back to what made him strong a minute ago, pass this off. Now we know that made him strong already, even if I don't test it. Then I can compare it to the next thing, and I compare the strong to what also makes him weak.
I got that. Thank you.
You bet. Yeah, it's happening pretty fast, so I appreciate questions like that.
Dosage on that for him?
In this particular case, hypothalamus pituitary is pretty powerful. I would go just one twice a day, one early and one in the afternoon. Again, when you feed the pituitary, it kind of upregulates you. So I don't think I'd take it at bedtime. I would take it like morning and evening meal, something like that. And I would take it before, under the tongue. In fact, I am on hypothalamus pituitary right now. And so I just get in the morning, I have a ritual I run, I have everything in the cupboard, and I drop it under the tongue. That's where I let it start to work.
Same goes with the Alamax too.
Alamax, you're going to want to go with meals. About just because it's going to last 4 hours good. So if your blood sugar is real bad, you're going to want to take it morning, noon, and evening. If not, you take it in the morning, first thing when you wake up, because you've been fasting for 8 hours, say, you want to break that fast. Alamax will help elevate the blood sugar, resensitize your insulin. But if you're pretty brittle there, then I would take it in 4 hours because it starts to dissipate by 4 hours, and then I take it at bedtime too.
For how long would you give the max hypothalamus?
What's that?
How long?
I'm going to recheck him every 30 days, and he's going to tell me. I don't have to guess. I'm just going to ask his body. But maybe forever. I mean, maybe he had a whiplash or played football, and he damaged that real thin pituitary going into the pituitary. I don't know. But every 30 days, I'm going to ask. You're going to do this every 30 days? Absolutely. Why would I guess when I can know? So I just put it down. Once a month, people come in for their scan. Twice a year, we do their blood, like we've been talking about all weekend. Now I have the big picture, and I have day-to-day. And people say, yeah, but blood and muscle testing don't say the same thing. I didn't ask the same question. Right? That's a completely different question. A muscle test is right here and now, energetically, what do you want, what do you see, what do you feel? A blood test is a period of time. Hemoglobin A1C is 90 to 120 days. Glucose is the last 24 hours. Even though it's the same kind of test, it tells you different information. Hemoglobin A1C is glycated hemoglobin, which is not good stuff to have an high in there. But muscle testing wise, let's say I'm going to do a homocysteine, and it's real high in the blood. Well, he's probably going to be weak to it too here, but it would just tell me right now, is he reacting to, say, pure homocysteine?
You ever find, if you run a blood test, and it says to do whatever for like 6 months, and you have the nutrients, maybe you check it initially, with kinesiology, maybe something's not checking, and then also maybe they're on the nutrients for, say, 2 months, and you check and something blows out, but the blood said do it, your AK said no. Whether you initially start or somewhere along the track, you're going to keep them on the blood chemistry stuff?
Yeah, I'm going to repeat the question. It's fairly complicated, but it definitely happens. Let's say you look at the blood study, and the blood study says, dude, you're in trouble here, you are not methadone properly, you need to take method protect. Because the blood doesn't know everything, and I check him for mental protect, that could really happen on him. And the body says, I don't want mental protect. Yeah, but the blood study said take it. Well, it's telling you, statistically, according to all the literature, you need the things that are in mental protect, B12, folic acid, methylglycine, all that. And it's all there because the body can't handle it. Because he has a special SNP the blood test can't measure for. But when we muscle test him, it said, I don't want that, but I'll take 5-MTHF, and I'll take SAMe. So I go with what the muscle test tells me to be very specific. The blood test gives me the big picture, especially blood and hair, but the muscle test tells me right here and now whether the body will tolerate and won't.
So if there was a contradiction, you didn't have something to replace it, and AK said don't do it, and the blood says do
That's
it.
what I'm saying. The blood said to do it, and the AK said don't do it. I go with the AK.
Oh, okay, go with the AK.
I do. If you're really good at it, if you're not, you can't do it.
Right.
I mean, if you don't know how to do that, you can't do it. You just have to go with the blood. Even with AK, taking good nutrition, sometimes the body's going to react to it. When it could be slightly toxic to you, it could be under exercise, all kinds of things. Sometimes you can't take 2 vitamins together. You need both of them, but you have to take them apart. So let's say he brought in 6 vitamins he's taken, and I put all 6 on his energy field, and he goes weak. Well, that doesn't mean they're not good for him. It means some of that combination isn't good. So I might check all 6 of those individually, and they're strong, but when I put 2 of them together, he goes weak, they have to be taken at different times in the day. So that's another part that can help. Yes, sir.
I have kind of a 2-part question. Occasionally I'll go through and I'll be scanning somebody, and on the initial scan, nothing shows up. But then when I link, for example, pancreas and small intestine together, they get weak. That's the first question. The second one, sometimes somebody will have like a rash on their neck. You test yeast, virus, parasite, nothing shows up. They touch the rash, they get weak. Then you touch the navel or the parasite point and they get strong. What's going on with that?
Goodhart said if you can't find it, we can't fix it, number 1. Number 2, he says sometimes the body forgets to remember. In other words, you could have a problem so long, you try to find it, the body can't even remember. It's been buried so long in there, you can't do it. The big tall doc that just left, he had to fly back to Wichita today. He actually has a machine he uses to where they play it, and the body can hear its own heartbeat, and all hidden problems show up. It makes it. Another thing you can do like that, and it could be how clear you're checking too. Sometimes if you're not checking just right, you have to go hunt and find for it. So if your energy level isn't up to par, then you're having to hunt and pack. If your energy is up to par, then it'll show. So you have to make sure you're in good shape, number 1. Number 2, you can have somebody, you can check them, and you can have them look in the mirror, and they look at the whole full body mirror, and you go back and check all kinds of problems show up in the whole full. Because they see flaws in themselves. Who's your worst critic? No, not your wife. The other one. We really are. We're hard on ourselves than anybody. When you look in the mirror, sometimes you'll pick things up. But that can happen. I'll show you something in just a minute. We'll kind of come off what you said and show you how to find that in the mirror. Let me finish this so we don't lose sequence here. I don't even remember what it was. Okay. Hypothalamus pituitary. And we already checked the infection points and it was viral. So we're really ready to go to the next stage with him. And the next thing is, we always check iodine at the end. The reason for that is, remember I showed you how fluorine, chlorine, and bromine have those almost empty shells compared to iodine, and they're trying to steal everything from everybody else? Well, that makes it where people can't use iodine. When I put this in his energy field, this should make him like Charlie Alice. It doesn't, it makes him weak. Because he needs iodine. How do you know he needs iodine? Because everybody needs iodine. You need 12.4 milligrams a day just to maintain. And I just put 12.4 milligrams, he goes weak. What I learned to do from there is to go ahead and challenge the body for which one of the homeopathics might trigger the release from here. In his particular case, let me show you something. If I ask the brain if there's anything wrong with his nose tube, we can fix it in a week ago. I don't need anything like that. But if I put fluorine by it and say, oh my gosh, I do have a problem. I forgot to remember that. Have them come up and help us a minute. Have the twins help us. They're good doctors. So we actually give you the drops. I can even ask these, but how many drops you need? You need 1 drop, you need 2 drops, about 2 drops of fluorine. Sometimes you only take 1. I take this, I suppress it to this homeopathic, and I put 1, 2 drops under his tongue. 2 things will happen immediately. 1 is, you will no longer be weak here. 2 is, we'll challenge him for the iodine now, Okay. Okay. I checked him here again, he's no longer weak to the iodine, he now can take it. So every morning I recommend you drop a drop or two into the tongue, and then you take your iodine. Now, if you check it, you don't need it, you'll use that, you can just take your iodine. But if you self-test or something, muscle testing, you get weak to the iodine, you have to find out which one you've got pictures of that before you take it. All of a sudden, you're making thyroxine. T4 is 2 tyrosine and 4 iodine. T3 is 2 tyrosine and 3 iodine. And the conversion to T4 to T3 is very important. It's selenium dependent, and that's why I have selenium and molybdenum in max iodine. But the point is, if you have too much fluorine, chlorine, or bromine, they're making up your thyroxine, and it isn't really 2 tyrosine and 3 iodine out. Maybe it's 2 fluorine and iodine. I don't really know how to ever figure that out, but I know with Brownstein, read the book Iodine by David Brownstein. Why you have to have it, why you can't live without it. Iodine, David Brownstein, Brownstein. They have like there's over 200 references. They found the same thing we found, and I found this before I ever read the book, but then now we have all the science to back up what we found in our clinical lab. So we send him home with iodine. We mark that down there. We're going to have to make one a day just to start with. We're going to have to get all 3 of the homeopathic halogens, fluorine, chlorine, and bromine, 1 drop one day, 1 drop the other, the next day, 1 drop the other, the next day. Unless you can test it yourself, you can ask exactly. But this way, you're just going to look at the time to detoxify. Now, the other thing that's happened is 3 things happened. 1, he's no longer weak to the fluorine. 2, he's now no longer weak to iodine. 3 is the brain will go on display where that halogen was bothering him, and so right cerebellum. So how long do we hold it there? Till it goes strong. Then we can check out what the next one is. And it's the right parietal.
How many iodine?
1 a day to start with. Okay, his sagittal suture is weak to here, so he'd have a right left frame problem, so we go till it's strong there. Check. Temporals, blue, problem there. Frontal, problem there. Good. And then heart is okay there. So we fixed 1 iron, we found 1 heavy metal, and we found 1 halogen. And that's where you could stop it, and now you just treat them. In my practice, though, I usually do a 3rd metal. I usually go back and I see, is there another metal? We won't send him home with it, but there's another one that might help detoxify very faster. I found I can do 3 homeopathics. Maybe 1. Sometimes the second halogen will show up. Sometimes the first heavy metal will show up the second time. Then I really know how bad they have that. But this time he shows aluminum. Now go back again. This won't tell us anything because we already fixed it. This will make him weak because he needs it. Now, isn't that a paradox? Don't we normally give a vitamin that makes you strong? Yes, right? If you find adrenal fatigue and he goes weak, you put max adrenal on him and he goes strong. Why would you give him the homeopathic that makes him weak? Because that's the rule. The homeopathic you need will make you weak. And then when you give him the drops, they'll go strong. And watch, how many drops you need? 1 drop? That's all you need. So we give 1 drop on your tongue. We're checking now. And he's got the strength. And the cerebellum will show up. And now it's the opposite cerebellum movie. It was right the first 2 times. Now we went to aluminum. It's the left cerebellum. We hope there it goes strong. And then we check parietal, temporal is weak. Parietal's okay, temporal's okay here. Occipital is weak there. Temporal's still weak again. We can check what goes like this. That's a good place to go with that one. Or if you see it, you just go around. Be careful when you're coming down, you don't go over the eyes, you take it around the eyes. Okay, we've got 2 metals and a halogen. We've got which nutrition he needs. Now there's another thing here. He's been kind of tired in school. I really want to check him, don't I, for mitochondria. Once, twice, 3. He's going to go 2 times, and the 3rd time he gets weak, that's not good. So we're going to give him max vital. 1, 2, 3, 4, 5, 6, 7, 8, 9. I mean, he needs that bad. That'll change his whole world for him. well, we heard some great things about Max Brain, which one of you is Max Brain too? Yeah, but now you're getting so many things, I'm probably gonna clean it up a little bit, then Max Brain, if you're going to school, and things will happen, Max Brain will help a lot of things in this system right here. Mitochondria are the most important right now for resuscitation. What I would do then in the real world,
So just like if you're in your own office, guys, and you're not don't have time to write as you go, I just pop them up like that. I know I showed some of this, so then you just have them popped up, and once you write them down, you push it back down. That way you don't have to try to remember. One thing I do, and I explain things to patients as far as like, you know, when you guys go see a medical doctor, right? No offense to medical doctor or anybody else, but I mean, how do you know which prescription to give you? It's really an educated guess, right, based upon what they're finding in clinical history. So that's kind of the blood test means. We have this whole list of things that it says they need, but then the muscle testing just helps you to say, okay, look, what do you use muscle testing? Because yes, we know from the blood chemistry what your body is calling for. We're not sure which one of these products is going to work best for you. That's where we're going to use the muscle testing. So hopefully we're not having to guess 2 or 3 or 4 times to get it right. We're going to ask your body to have a preference. So that's kind of how I would address those ethics. I'll muscle test a lot of times. Choose the top 2 things when I'm my muscle testing, get the blood chemistry back, and then from there do the rest. Even though I'm already done my muscle testing to start with. That's all.
the next thing I would do, if he's a real patient, I would do the adjuster. So we start, once you turn sideways. Okay, good. Frenchie. Frenchie. Swing feet. I'll make her earn her adjustment scoot a little bit. Just so you guys can see it. Normally I'd have you just sleep there, I would go here, and deep breath in, breath in, breath out, breath in and out. And that's the way we do it. And then I'm going to do cervical spine. Again, this is mirror image adjusting here. If it's one shoulder's high here, I take it down, I hold from where it is. His head's twisted that way, I go back this way, the opposite direction. Slide and glide. Stop it at axis, I don't want to go to atlas. Then the last thing I would check here is, I would check atlas. Drake, you're going to come help Daddy? Brett used to say too.
He's a mama's boy.
I need help.
No.
So this is Treg and Tegan. And Sienna's over there. You know, a lot of you remember Natalie when she used to work here. They helped me a lot. Okay, that was pretty tight that we tapped the atlas in. The third thing we always want to check in this area right here is we're going to check for discs. So why don't you turn around, flip around facing them, and make sure we get this for everybody to see. The way you check for a cervical disc, both right here and go down. You just come this way, hold, he's okay. If I go this way though, he's not good, is he? So if I do like a frown or compression here with a muscle test added to it, it goes weak, that tells me there's a disc on that side. Is it this one? No. Is it this one? It's right here. So I can literally take and tap here. You come internal to the external cleidomastoid muscle. Colonial. I just tap that in. You only turn about 10 degrees. It's a little tender in there. You come back and check that though, you'll clear out a lot of cervical disc problems, carpal tunnels, tennis elbows, that type of thing. Line it back. What I can check here is to see if there's any chance that he might have a disc in the low back. And the way we found the disc in the cervical area was compress it, so we can compress this. He's no problem. I compress this one, no problem. I stretch down this way, he gets weak. Uh-oh. I stretch this way, he gets weak. That's imbrication. That's where the facets come together here, and he's stuck like this. So now we take the adjuster, and we go diagonally like this, and then like this. We do all 4 quadrants, and it releases the iliopsoas muscle this way, and it helps to free up those facets. Remember, the facets are just loaded with nerve endings. So I come back and stretch that again, hold, and he's corrected, hold, and he's corrected, no problem. While he's here, though, I'm going to check it for that category too. The way I do is just touch here and here. So I'm going to check left PSIS and right ischium. He's okay. If I check right ischium and left, he equals weak. Now, we corrected this last night very quickly, but we have more to do before that's going to be able to hold. So I'm going to use blocks. I don't see mine up here, so if I don't have blocks, I use the laser. I go here, and I go here, and then you can go up into the shoulders, and it gets weak even up there, so these are quite a torque pattern. Now remember, when you get a recurring category 2 is actually torn ligaments. So max adrenal would be something I would give him 3 times a day at least, and start strengthening up, strengthen the sartorius and gracilis muscle, and try to release some of the stress that's going on there. So while he's doing this, the next thing I want to check is we know the hip ties into the jaw. We go here, the right TMJ is showing. To release the TMJ, I turn it down to 3/4. I come right on the condyle here, my listening hand's scooping underneath the back. And there it goes. Another question I'm going to ask him while we have him here, raise your hand up in the air here, turn this way here and hold tight. What about the cranium? Breathe in deep through the nose, hold, exhale, hold. Okay, not a problem there. Breathe in through the mouth. Hold tight here and don't go away. And he's okay that way. So we're in good shape there. If he got weak, you breathe in and out through the nose, you percuss right here. If he gets weak breathing in and out through the mouth, we'll go right here. Now we'll see, just check him in the clear. You don't want him touching anywhere, because if there's a spot that was active there, it might give him a false reading. He goes weak now. Well, he wasn't weak to start with. What happened? He's on the blocks. He doesn't need the blocks anymore. That's done his job. He wanted to go weak. That tells you you've done your job, and you can take the blocks out now. And now we go back, and he'll go into strength. The only other thing I might do to look at that, I might just check, is there anything that needs to be done muscle testing wise or fascia release wise? So I'll show you here. I see, is there anything, this ankle, knee, but hip, boom, right here he goes weak. Well, that can cause a recurring in category 2 because it means that the femur head sitting in the acetabulum is crooked and it keeps pulling the hip out. If you actually don't have to do this, but for demonstration's sake, we can twist the femur head here, it goes weak. Twist it the other way, it goes strong.
Dr. John, did you essentially,
Say
Dr.
again?
John, on this, when you're challenging really to use the percussor, you're keeping that in your head, so it's part mental challenge?
When I'm doing it, I'm just asking, do I need to do the ankles, do I need to do the knees, do I need to do the acetabulum? And then that's when it came up. I was self-testing like that, and I found it. But muscle testing, I would just go here, and there it is. It's just so weak. So that thing is sitting, it's like a pry bar, right? With enough leverage, you can move a great big rock with a little guy. So that leverage, that femur head is torquing that whole hip out of place. Even when you put the hip in, if you don't go ahead and drop the femur head in, then it's not going to stay. Fair enough to everybody? I'm going to take the percussor now, and I'm going to crank this dude up to about 7 or 8 now. I'm going to really get up there, and I'm going to, normally I'd be on that same side, but I want to just let your legs and feet come together. There you go, a little bit more. There you go. I want you to see it, so I'm going to come right on that greater trochanter, and my listening hand's going to come over here, and I'm going to bring that energy all the way across the pelvis. This realigns the femoral heads and the entire pelvis. There it goes, there it goes, there it goes. I just felt that whole pelvis area shift fascially, and we pried it into place with the wedges, and now we finessed it. So I come back and check here, and I'm all right. And I could just say, what about shoulders? Anything else in the TMJ? Cranium? No, turn facing me over here now. On your side facing this way. So I'll do usually 2 fascia releases on the front side of the body and 2 on the back side of the body. I don't want him in a lumbar roll position. I want him in a fetal position. I'll say, and here I'm just checking, is the sacrum, the coccyx okay? It is, but the sacrum isn't. Oh, there's heat coming through the heat. I mean, it's like you feel the heat coming on the outside, you burn your hand almost. This has had so much inflammation, we're releasing it now. So I guess an ice pack would be good. PEMF out there would be incredible to bring more energy back into here. But that's what happens, our muscles get weak, the energy gets off, so we can beef them up with all this great equipment we have. But I want to release that second sacral segment. So I come right here, and remember, the sacrum right there is like this, isn't it? It's not horizontal, it's tipped. It's actually tipped like that, because the sacrum comes down to the apex and the coccyx goes this way. So however that bone is you're working on, that's what you do. You come right here, and the upper part of the sacrum is this way, and it goes down this way. I want it completely flat. This hammerhead has to be flat on the area I'm on. So here we go. Second sacral segment, listening hinge is on the pelvis here, and right in here. And there it goes. I'm just going to check anywhere else you can release. I don't find anything else. That's all you get for today. I'll see you next Thursday, right? You're welcome. Okay, this has to go cat. I'll just slip your jacket off. We'll do one more demonstration. We'll answer questions and go from there. I know it's getting close to something. You gotta get out of here. Sit there facing that way. Let's go through the routine one more time. Make sure everybody's got that. A ton of questions on that. And it seems like no matter how many times we go over it, there's so much we're throwing at you at one time that it's hard to keep all of it straight. So in the real world, this is the way I would do it. I would check here. Number one, is she testable? She is. Is she switched? Uh-oh, she is switched. She wasn't supposed to be. So I check her here, down, and it's not the adrenal fatigue, it's electromagnetics. What do I do with my phone? Here it is. So she's getting bombarded by too many electromagnetics, and down she goes. So if I put a magnet on her, and I check her with my smartphone, she stays strong. So she's taking her adrenal. She didn't get weak when I did adrenal stretch, but she did get weak with electromagnetic. She needs to wear a magnet, or maybe even two for a while, until she gets things beefed up there.
I think having a lot of metals influence how sensitive you are to
Yes.
Okay.
Yeah, absolutely. If you have a lot of heavy metals, it's heavy, man. Yeah. It just messes up your electromagnetic flow, because you're short-circuiting out the metals in your body, really. But everything's toxic, it's turbulent. So what are we going to do? Well, we need to fix her. Let's go back to that range of motion study, because we always want to look at things. No helping me now, relax. Don't be like doctor over there. Singing doctor. You're not stuck like that, you shouldn't be. She should be free and easy. She was really sick last year. She's doing a ton better about working out, running, and everything else. But something's hanging her up. She picked up lines.
Dr. John, don't you have to give her the magnet? Get her
Say
the
again?
magnet? Don't you have to keep the magnet on her? Because if she doesn't have it, she's not tested.
Well, you could do it, but the magnet, just when you strengthen her, it'll last long enough for the test without any problem. The only reason I don't leave it on her is they'll put it in their pocket or somewhere, and I forget to get it back, and I have to buy a new one. I want them to buy a new one going out the door.
You're saying just were you putting it on her?
It stays 5 minutes without a problem. That's a good question. That's the answer. So the first thing I'm going to do, though, before I fix anything structural problem she has, but I'm going to say, well, what metal are we dealing with? That's interesting. She showed two things. She showed nickel, and she showed chlorine. So I'm going to ask, which is the priority? Remember this? There's the priority mode. I can ask, which one is the most important? It says nickel precedes chlorine. If you get two, that's what you have to do. You're just going in priority mode. Because both would have made her weak when I test her. Reminding you now that if I ask her clearly if there's anything wrong with it, it's going to say, hey, my cerebellum's fine, my vitals are fine, my temporal's fine. Why are you asking me? Because I know you're hiding it in there. You're not telling me the truth. I'm going to give her some nickel. I'm going to drop one drop of it. I'll just self-test. One drop at a time. Well, that's not very much. Well, how many tablets? Remember, a little is a lot. Now, the nickel will no longer make her weak. Her brain will go on display and tell us exactly where we need the lasers or right cerebellum. And many times, the range of motion is complete. If you'd have felt this, you'd have sworn she had ankylosing to this point. Now it's gone. So the nickel toxicity in her body made her range of motion up. And And this is so impressive to patients. It's impressive to me, I've done it a million times. Unbelievable, just a little one drop, and all of a sudden, no more frozen shoulder. Yeah, so it's a toxin that's binding her up. And now, I can go ahead and treat the area of the brain that's in trouble. We already found the right cerebellum, and normally we're gonna hold it till it goes strong. I can feel that, so just to save time here, I'm just gonna do a mold. She has sagittal suture, frontal occipital, brainstem, and heart. So it really helps if you can just see stuff, you can just move really fast. You always want to go slow in the beginning of the patient 2 or 3 times, let them feel it, let them strengthen, and go from there. After that, they don't really care, just fix me, right? But it's important that they know what you're doing and why you're doing it. Now what happens? Well, we do the scan. You already got the scan this week or no? Yeah. Okay, you have that. So we won't do the scan. We'll go to the end of the scan, which is what? We check, we do the iodine challenge. We go over here, and she gets weak iodine. Oh, darn. So which halogen does she want today? And we already found that a minute ago it's chlorine. Two drops of chlorine into the tongue. Over here where she's no longer weak here. But she's weak here. Opposite side we found a minute ago. So you can assume it's going to be the same cerebellum everywhere. And it's the temporal side here, it's temporal here. Then we'll hand on occipital. Turn the heart back on. Now, excuse me, I'm coughing because something's coming out of her up here. I mean, it's getting hot. I'm just burning up. Wow, I'm sweating. Yeah, she's a hot baby. I've always known that. And so, I mean, literally, I am just sweating. So something coming out of her is very, very toxic. My nervous system's picking up on it. And it's kind of like John saying, you feel it. You feel what's going on with people. And I'm really sensitive to that. So that's why I have this got disconnected. Usually I have the total shield on all the time. I have good ventilation in the room, so we're working up a lot of toxins. Yeah, she says she feels like she's shaking. Something's coming out so toxic. Well, I'm going to do one more metal if the body calls for it, and it does. It's very one drop, so I'm going to do that one more. Now, one thing, she has dissimilar metals in her mouth too. She still has the amalgams. Eventually, we probably all need to have that out. But boy, if you do, it needs to be done very, very good. Again, it needs to be done by somebody who really knows what they're doing. They need to do no more than one quadrant at a time. We need to measure it, find out which is the most active, so we can do it. This sounds right, I'm not going to go. There's sagittal sutures involved. Over here.
Dr. John, when you're talking about the metals, you can do 3 metals in one halogen or a total of 3?
What's the question? Would I do 3 metals?
Yeah, do you use 3 metals and a halogen?
No. I usually do 1 halogen and 2 metals.
Okay.
But if a halogen doesn't show up, I would do 3 metals. I did have one person I saw, they showed up 2 halogens before they wanted to do a metal. But that's never happened before or since.
Okay, before did you would ask for metal and then you clear all the metals and then the halogen? You're just asking
It doesn't
for
matter.
Okay.
As you see, they're all lined up right here.
Okay.
I usually put the 3 halogens on the end there, but I will check across. And if a halogen showed up first, I would do it. It just usually doesn't. Usually a metal is going to show up ahead of a halogen.
So 2 metals.
1 halogen, normally is what I'm going to do. But sometimes you have to challenge for the halogen by seeing if they can take iodine, like we did there, right? And if they can't, they've got, you need it, you have to have it. Okay, she had the, did I hear a question?
Just a quick question. If bromine, for example, allows the body to accept the iodine, why do you give the other halogens? If you test them, it's only bromine. Why do you have to take the other?
Good question.
Can you repeat it?
What is the question?
Question is, if I just checked for bromine today and that's what made it weak, what would make me send it home with chlorine and fluorine too? Because I know it would be impossible not to have it. It would be impossible for anybody in this room not to have all 3. Because there's fluorine in the water, there's fluorine in toothpaste, they stick it everywhere. Chlorine is everything, every drop of water you drink in the valley here has chlorine in it. You use Clorox bleach in your thing. And bromine, they're poisonous with chlorine. You ever get a new car, right? You always try new Lamborghinis. And that smell that comes off that new leather, that's bromine. When you get in an airplane, it's bromine. When you buy a mattress, it's bromine. When you have baby furniture or anything, they douse it in bromine. Because the powers that be, I know somebody that sells bromine, talk them into the fact that bromide is a flame retardant, so they spray it all over everything. Mattress covers and everything. So every time you're laying down at night or driving a car or flying an airplane, every so many air miles, they have to go in and douse the whole airplane with bromine flame retardant. That's retardant.
It's also mold retardant, that's why we put all the rings.
What's that?
It's also mold retardant, that's why we put all the rings.
Bromine's a mold retardant.
That's why.
Yeah, you know why?
It's bromine. All the purity is bromine plus.
But there is zero use for bromine in the body. They have not ever found one use for it. So the powers that be, they were putting iodine in bread so they could get a little more iodine. They realized that a lot of America was iodine deficient, so they were putting iodine in bread. Then somebody says, maybe we're getting too much iodine. Why don't we put bromine in it? And that's why most of your bread has bromine. Yes, sir.
When you're using the lasers, are you just using like unwind pretty standard on whatever you do, or are you using a range setting?
You can do whatever you want to do because unwind comes up first, and that usually works well. I just do unwind most of the time, or I might go down to quantum or waveform. I usually don't go all the way to brain, just it takes me longer to find it. And I haven't found it makes a big difference because just a short time you're balancing the brain. Seems like any laser, no frequency. It doesn't take a specific frequency to balance it, to answer your
So
question.
for everything you can do in a day, you
I've just done
automatically
unwind.
go to unwind.
But if there's a lot of infection showing up or anything like that, then I would go ahead and do, I would do pleo. For pleos, for pleomorphic, for any type of infection there might be. In her particular case now, I wanted, yesterday she had the adjusted because she's on that and did a great job, but I want to go into deep cranial questions, so just line me back. Because we haven't demonstrated this in my class, we did it for another time. We're going to find out if we need to do any deep cranial. Hold tight here and don't go away. She's weak and clear. That's certainly not good. Breathe in through the nose. Breathe out. She gets stronger breathing in through the nose, so we know that's an inspiration cranial fall. Breathe in through the mouth. Hold tight when you go away. And breathing into the mouth makes her weak.
Dr. John, isn't weak in the clear is digestive enzymes?
Weak in the clear means bilateral weak pectoralis major clavicular has to do with digestion.
Digestion.
Anything.
Yeah,
It's just
digestion.
hydrochloric acid deficiency. A lot of times it can be allergies.
HCl.
But the fact, if this cranial doesn't fix it, then I'm going to go there. But knowing the fact she was able to breathe in and get strong, that's inspiration cranial. I'm going to start with cranial on her because we have a past history of her needing cranial from some of the trauma she's had. And I know she's on a pretty dang good diet, takes pretty good supplements. But if she was a brand new patient, that's the first thing I look for, digestive enzyme and hydrochloric acid. Very good form. Once you switch around this way, just so I can sit down there and work on that. All right. When she breathes in through the nose, Dr. Dell, find Dr. Brett. I want him to answer your question about abstract. We're going to do the cranium from the center of the head here right now. Again, show you up here. Turn here, let me go away. Okay, now just from doing what we've done, she's kicked back up. She's kicked here. If I just touch the top of the head here low, and I turn her, lift it up, down she goes. So it's really a cranial problem. She has abstract with this, knowing your case history. You say, well, if you already adjusted her once, why did it come back? Well, she's a wild woman from Nashville. She skis and runs and all kinds of stuff. Married with children, all those traumatic things. So I'm holding her cranium here, and I'm percussing from above down. I'm right in the suture where the baby has a soft spot, or if you're an acupuncture, it would be like GV20. It's the point at the top of the head your ears point to. It's called the point of 100 conditions in acupuncture. Everything from heart to hemorrhoids. There we go, there we go, there we go. out. And this is an issue. We live in such a stressful world. Travel, and just emotional stress, finances, IRS turn to face that way, dealing with insurance companies, listen to Randy talk about compliance and ICD-10s and all that stuff. Come on, guys. And Dr. Singer and Dr. Badge, who's the president of the Arizona board, he came to say hi to us here. And myself, we're all three talking out there. We all practice now just for fun. We adjust somebody just for fun. We don't make a living doing it. We all three said, this insurance thing is getting so crazy. If we went back into practice, we probably would just cash and not deal with all this stuff, stress. Well, Brandy says, no, you can still make a lot of money doing that, but you got to know it right. Well, if she ran my office, I wouldn't worry about it. She can do all that stuff, and I'll just do what I do. But in this day and age, you better know what you're doing. You better have the good software. That's why Brett has Chiro Touch out here. Brandy recommends Chiro Touch. That's why we have them to help you know if you're going to do electronic health records. They'd be good people to talk to. The next thing I'm going to do here is I'm going to go right here. Why? Because when she breathes into the mouth or out of the mouth, she got weak. So I'm going to go right on the bump here. Everybody feel the bump on the back of your head. So external acceptable for 2 minutes. And I'm going to shoot that energy from there diagonally up to here in the topic suture when you're a baby. The air is ossified, but that makes sure the brain is working completely well all the way across. So this one opens you up this way. This one opens you up this way. So your whole brain starts moving better. I'm going to hold the frontal bone here. I'm going to come right on the EOP. I'm going to bring this out. I wind it up. I feel it getting tighter and tighter and tighter and tighter. And there it goes, there it goes, there it goes, and unwound it. Incidentally, for a hands-on seminar, Dr. Brett and I are doing some like one-day hands-on seminar. We did one in Phoenix, one in Tucson this last year. So if you're interested in that, just call Jason and say, hey, when these guys come and do a one-day seminar, we'll meet here in Gilbert, Brett's office. We get 20 people at a time, and Dr. Brett and I will teach that, and we'll teach you and let you feel this type of work. We don't give about enough time in a seminar like this, and definitely one day, if we're just teaching one-day oral seminar, you don't get much. But that will do that. We'll do another one here in Phoenix this year, and another one down in Tucson if you guys want to. We have one of the offices down there. But that guy sent Selena back to California, so we'll have to use somebody else's office. But we'll do that. Let us know. Okay, back on your back. Because really, you guys need to get this touch and this feel yourself of this moving. Hold tight, don't go away. Now breathe into the mouth. Out. Hold. Into the nose. Out. Home run. Now, there's other things we can ask. Put your thumb in the roof of your mouth, just touch the roof of your mouth, and go down, and that goes nothing. Holy smoke. We know she needs hypothalamus pituitary, but that happens in the pituitary pump. So I need, Dr. Brett, do you know what happened to our gloves? Our rubber gloves yesterday, where any of them got put?
I didn't, in your bag, I don't have.
Jason, have any back there?
Where's your bag at?
Okay, I don't have any in there, I know that. Okay, well, if I don't have one, I'm going to have her help me. I'm having her put her thumb in the roof, but I need one. I need to find one. See if you have some back there. I don't know what happened to mine yesterday. Put your thumb in the roof of your mouth and press that. And what I'm going to do is I'm going to rock her occiput forward. I mean forcibly, 5, 6, 7, 8, 9, 10 pounds, while she's pushing up the same amount of pressure. Breathe into your nose, out. Good. She's moving her toes toward her nose. She's pushing up with her thumb as I'm doing this. By doing that, we pump that pituitary. This is something she can do at home every day. I found some, Brett. Thank you. So now when we go here, and now you touch the roof of your mouth, no problem. But if I touch K27 on one side and spleen 21 on the other, the lights are going to go out. It always knocks it out. So after you pump the pituitary, you tap K27, spleen 21 contralaterally. Like that. Yes, sir.
Do you ever check the sphenoid for laterality?
Well, I'm going to show you that in just a minute. I mean, when I'm doing it myself, I feel it and I unwind it all at the same time. But the main thing, after we do this, if somebody really has a bad problem, you go in through here, and that completely aligns that.
The fruit jar?
Yeah, the fruit jar. So the next thing that I want to test for, and I usually even just see if it's rigid in there, but if not, you would test for it. You're on the outside here, and you go inside between the gums here, and you just torque it this way, and you torque it this way. You just go like this. Thank you.
Can you, is that the way you challenge for it? Do you challenge for it?
Yeah, you can challenge for it.
You can.
What I do mainly, when there's a problem there, I'll just feel for it more than challenge. I'll go in, and I'll go one way, and I'll go the other way, and like going this way, she goes pretty easily back this way, there's nothing. But the case history like hers tells me more about than a challenge, but you could challenge just by pushing the outside. So I just really holding firm here, I'm opening the jar. I'm opening this cookie jar, turning it to the right. And then I'm going to open it back to the left. Oh, well, that felt like it went 1.5 inches. I'm going to the right, did it probably about 1 millimeter or a micron or something, but when motion is there, it just really feels good. There's just no, there it goes. Finally releasing on this side, there it goes, there it goes, there it goes. So I come back this way until that's moving nicely together. Now, I'm going to do side bending this way and then this way. I don't even know if that's taught anywhere, but I have found it gives me a new dimension where I'm opening up the malars to the mass, to the upper palate here. And now it really starts that cranium moving. And they've actually done before, or during times contrast median MRIs, and they've watched the disc bulges actually suck back in doing this work.
Is this because you did the pituitary stuff, or is this separate?
Say it again?
Are you doing this right now because you did the pituitary stuff, or is this just a separate?
This is completely separate, but somebody is really weak, really tired, really bombed out, or chronic low back pain, you're not getting it straightened out, this really helps it. It's just a deep cranial, so I want to demonstrate. And it's really not that hard to do. It's not like you can mess anybody up. Like with a percussion, you really need to feel it. This way, you just hold here, and you come in here, and you go like that.
So that inferior hand is on the maximum?
My hand is on the up. You're actually on the T. Okay. You're affecting the whole maximum, both sides this way, while you're holding the malar bones up above it. You're holding the malars here. After I do that, though, I want to check the malars, and I just come up like this, and just tug up gently. And you'll feel if they're restricted, you just hold up, and then you'll just soften, 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 excellent. Then the lacrimal bones, these two little bitty bones in here, can have all kinds of things that affect your sinuses and migraines and things. You just come up here, and you just slide your index fingers right along those little lacrimal bones, like that, and you just tug up gently. And this can help sinuses, headaches, deep head pressure, migraines. I have a whole family that when I did this to them, migraines were on me, that never helped them before. There's a major reflux that opens up the whole brain and sinus area. Okay, very good. So that shows you some pretty good deep cranial work. Turn the face over here. The other thing you might want to make sure is on your side. Just on the other side. The only other thing you want to really make sure if you do cranial like that is make sure the sacrum and the coccyx are moving free. So we can check here. Hey Dub, he got away on me again. Dr. Greg got away on me again. See if you can capture him. I'm ready for him. Okay, coccyx is good, but the sacrum isn't. So I'm going to come right there, cranium do it up to 7 or 8 pounds. On tailbone, I keep it on free form. But right here on the second sacral segment, I'm going to release real fast, so that's it. Okay, ma'am, you are ready to go to Nashville. Very good, thank you. All right, I just wanted Dr. Beck to come up and answer any questions. We're short on time, but we promised that he would share this time with me. So I'd like you to take